Hello everybody! Hi internet and YouTube, it's been a while. So I thought I would get back on and give another little update after surgery number 2. It has been almost 7 months now. I meant to do this after my 6-month follow-up appointment, but time and whatever hasn't allowed that. So anyway, I am, almost, I'm almost 7 months post-op ACDF at my C6-7. You can see my lovely scars going on here. This is my second surgery. I had a disc replacement in 2018 of 4, 5, and 5, 6. And then if you've seen a couple of other recent videos at the beginning of the year, I had to have another surgery. So thank goodness I was able to get all of that in, and all of this happened before coronavirus and all of the quarantine and everything. And so it has been a little bit different of a recovery this time around. I mean, it's all been good, but I've almost forgotten that this has happened to me because of how life is now. Like, everything has changed, and I've had so many other things to focus on and think about and worry about that luckily this got taken care of and is out of the way. So yeah, I just wanted to kind of give you the update. For the most part, everything is going really good. I can show you, I got updated x-rays. So this is me now, very bionic. So the top 2 are my disc replacements. Those are Prestige LP, what are they called? Prestige LP, yeah. That I had done in 2018. They're kind of like ball and socket. You can kind of see the top part has like a little groove or a little like bump, and the bottom has a groove in it. And so these pictures were static. He didn't have me do any flexion or extension. So ideally when I do, you would show movement. There would be like opening up of the space there. And then this down here is my fusion, which is there's a cage in there, and then the plate and screws in the front. You can see that like white line. I asked about this because I wasn't sure what I was seeing. So this white line is actually some kind of marker on the actual cage that goes in, this kind of the spacer between the 2 vertebrae. And then now right at 6 months, you can finally start to see bone growth. So that's kind of what this little column is here, and I think there's some back here. So you can kind of start to see that the bone is growing and fusing, and that's what the doctor wanted to see. He said everything looks great. My curve is not so great. My curve wasn't great to begin with. It was actually worse before my first surgery. It was like I was bending the wrong way. Instead of having a lordosis like you're supposed to have, a little curve forward, I was almost curved backwards because those discs were opening up the spaces behind my neck. So yeah, I am 38. I had just turned 36 for my first surgery, and 38. I'm 38 this year. So yeah, I'm kind of a weird anomaly. The doctor told me that not very many people have this hybrid situation going on in their neck, but yeah, so this is what I look like for now. So this was 6 months, and then you can kind of see a difference. I have my same thing for earlier. My last video was at February, March, May, 3 months, and you can't really see those columns really filling in yet. So that's about how long it takes to just start the bone growth process. I am not fully fused. I don't have bone, throughout, from front to back, throughout the whole vertebrae, and I don't really know how long that's expected to take. Probably till a year or so. But at this point, for my surgeon, he told me that I am discharged. He's seeing the progress that he wants to see. I don't have any complaints as far as function, strength, pain, any of that. I will say that I'll never be back to where I was before. I don't think. I always continually I'm still aware that this has happened, although some days I forget, which is good. But I have neck pain. I have shoulder pain, but it's like an achy pain. I have trouble, but none of this is like debilitating. It's just something that I notice. It's like on a 1 to 2 on a 10 scale. I have trouble finding a comfortable position to sleep in. I still, maybe once a month, maybe once every 2 months, I will take the time to sit with an ice pack on my neck because I feel, if you overdo it, if I lift too much, if I work and do something too hard, I will feel it more than I ever did before. Some of that's probably age. I'm now kind of in that middle-aged sort of range, getting up there. But so it's not the same as how you bounce back when you're, 20, 30. But that may be part of what I'm feeling, just that age. But I'm also, I've gone through this surgery. I've been, you have trauma with that surgery. Your body's just in a different alignment. So it's not back to where it used to be. I still have little twinges. I even still, once you've felt nerve pain, once you know what that is, that shooting pain down your arms. And even for me, with my first surgery, I had stenosis and myelopathy. So I had symptoms in my legs. And so I will still, every once in a while, get a twinge of that. It will just, I don't know what it is, if I just have inflammation, if I'm just in a weird position, if my body's just going through something. But I'll still have those little twinges of reminders of oh yeah, stuff isn't perfect in there. So to say that I'm fine and I'm back to normal, I pretty much feel that way. I can almost do anything I wanted to do. I'm very, very cautious though. I don't go horseback riding. I don't go ride four-wheelers. I don't do jarring, aggressive behavior and activities and things like that. I even noticed just dancing, moving my head around, just bopping around with my kids and stuff. I can't do that like I used to do. I can't move my head as quickly. I probably can, but I just feel more cautious of my neck and my body. I have to be a little more aware of my posture, which I'm not very good at that either. But when I am more aware, it makes things better. It improves that. So yeah, I kind of just thought that would be my little update. I've noticed a lot of people have been actually paying attention and commenting on my videos. I kind of did this just because, for one, when I first started doing my research and learning about what I had to go through with this surgery and this herniated disc and all of this, I watched a lot of videos too. And so it really helped me to see real people talking about their progress and their experience. And I think that really helped me. So I wanted to kind of do that for other people. Because I feel like it's very common to have back and neck problems, but it feels like when you're going through it yourself, you feel like you're the only one. You feel like, why is this happening to me? You feel like it's not something people talk about. People talk about hip replacements, and people talk about knee replacements, and people talk about, other things. But for as common of a problem as this is, I don't think a lot of people talk about it, or you don't hear very much about it. But yeah, so I kind of wanted to share my story with everybody if anybody cares to listen. But it's been nice to see some comments, and I've seen several of you saying you're about to go through this. So I hope that you all are doing well. I hope that you all are recovering and taking care of yourself. I hope that you all are finding strength that you need to kind of make this decision, because it's not easy. I will tell you, I had sleepless nights and anxiety-filled days of worrying about having to have this surgery. And okay, I had the surgery the first time and great, it's all solved. And then to kind of be knocked down again and oh no, you have to do it all over again. It's I thought I had this behind me. I thought, and that still may not be the case with me. That's the one thing my surgeon has definitely said. He's you have to be careful with everything you do for the rest of your life. You have degenerative disc disease. You have a spine that is prone to having herniations. And so it may happen in my low back at some point in my life. It may happen at adjacent levels with the surgery that I've had. You saw my spine. My spine is straight. It's supposed to have a curve. You're anatomically and mechanically supposed to have that there to kind of make things work properly, and I don't have that. So yeah, it's something that I've got to be aware of kind of forever, and that may be the case with a lot of people. Now, people who may have had a specific injury, like car accident or something, that might not be the case. Your body may be fine as far as how your body responds and the discs and all of that. But for me, I did not have a traumatic injury. I did not have a specific cause. It just happened. And It may have been anatomy, it may have been my posture and positioning over years, it may have been work, who knows. But yeah, I didn't have a specific injury, which is what made it all the more kind of confusing when it started. But I definitely want to just hopefully give you guys some encouragement. Like if you are going through this, I would say, obviously I'm not a doctor, I'm not a physician, I'm not a surgeon, I'm not a neurologist, but for the most part, it seems to me that people have this surgery and they go on with their lives. Like they recover and they get better. There are always going to be reminders that this has happened to you. For me, it's the kind of the back of the shoulder pain that I still have, and certain positions that are not easy to move in. Like I don't have very much lateral flexion in my neck. I pretty much can go up and down the way I need to, and I can go side to side. But at the end ranges of that, I get tighter than I used to get. So I can't go like this. Like, you used to be able to like hold your phone, not this kind of phone, but like old school phone, like real phone. You used to be able to hold it like between your chin and your ear, and I can't do that. So those little weird things that you just start to notice. My voice and my throat and my swallowing were never a problem, never were bad. There was swelling, and I think I commented at the beginning, I had a big knot at this second surgery, and I see a physician's assistant and the surgeon every time I go for my visits, and the physician's assistant, she said that it's more common the lower levels to have the more swelling and that kind of that pocket of scar tissue. It is gone. I mean, it's gone now. But it was kind of bothersome. It was kind of concerning at the beginning. I thought, oh no, I've got like some infection, or I've got, they always worry about hematoma as something that can happen. And so I was worried about that for like the first 4 or 5 days. But it went away, but it was, your body just kind of has to absorb that stuff back up. But that being said, with I didn't have dramatic, I could eat and swallow and talk. My voice is not as strong as it used to be. Maybe that's because I've been in quarantine almost since the day I was able to kind of go back to lifting a little bit. And like after a month, my surgery was at the beginning of February, and by the beginning of March, that had been my month time. And so I had like 1 week of being sort of normal, and then it was like quarantine, don't go anywhere, don't see anybody. So I've not been maybe talking that much. I don't know. I have been we have kids, and I talk to my husband and whatever, but I haven't been projecting. My voice gets tired with that, like projecting, having to talk like this, like through a screen or on a Zoom call. It just gets more tired. I feel it more. And every so often I will get like a lump, like I can feel that there's something going on in there. It's never been really a problem, but it's just one of those reminders. It's kind of like, oh yeah, like there's something, you have foreign objects in your neck. So there's a little bit of that. And not to say that's discouraging or to be like, oh, you're gonna live with this for the rest of your life, but it's just kind of the reality. And it's not that bad. Like for me, it's not that bad. It's annoying, but it comes and goes. So there are times when it's totally fine and I feel like I can do anything. And then there are times where I'm like, well, I'm not gonna sing opera, like that wasn't what I was gonna do anyway. But yeah, so that's kind of my little update as far as surgery is good, healing is good, but there's going to be things that you kind of will know about for the rest of your life. If anybody's ever had any other surgeries, you kind of know that you're trying to recreate what your body was meant to be doing, and these are artificial things that are doing as best that they can, and so it's always going to be a little bit different. Luckily, I can say that for the most part, I don't have any limitations, and I mean, to live without pain is such a blessing. Like it's such something that's taken for granted when you have pain. Like when you're finally actually experiencing what that pain could be, that nerve pain, that's a different thing than, scraping your knee or anything like that. It's just a different level of pain, and it's kind of unrelenting. And so to finally have that gone and to know that, okay, like this solved the problem is a big relief. I know that not everybody has that experience. I know that sometimes it doesn't, but for me, What I think made the biggest difference was not letting it go for too long. I was able to do that kind of as a double-edged sword, because both of the times my herniations went straight back and they were impinging on my spinal cord. So that was a pretty clear indication that this needs to be taken care of soon, as opposed to people who have impingements that are going on just on a nerve root on one side. Those, I think people are thought that they can live with longer because whatever, it's not your spinal cord, it's just like one piece of it. And that's when I think it seems that maybe people go longer. You could get injections, you can try therapy, things, you kind of draw it out. And I think one thing that helped me is not waiting that long. It's a hard thing to do. Who wants to jump into like having a surgery? But I think because I didn't have a lot of damage, I didn't take, months and years of just recurring damage and pushing on that nerve, that it came back to life relatively easily. So I hope that is informative for you all. I'll try to keep updating you. I kind of, again, like, I feel like he gave me the all clear to not have to come back for any visits unless I have a problem. So that was kind of surprising. So I don't have any major, I won't probably have any new physician updates. Knock on wood, hopefully I won't have to do that. But I'll try to keep updating you just in general, how is it 9 months, how is it at a year, whatever. Since now I've been doing these videos for over 2 years, 2.5, I guess. But anyway, that's kind of me. I'm able to have experience from both ends. I've got disc replacements and I've got fusion, and we'll see. Hopefully they hold up. I was looking at these before I shared them, and I mean, I'm crossing my fingers for now, but my disc space here looks pretty good. Hopefully that's not going to turn into adjacent level. I mean, and the nice thing is that these allow some movement. Now you have to keep it you have to actively make that happen, or they can kind of freeze up. Your muscles will just tighten and they won't have as much movement there. So you have to kind of still do stretches. That's another thing that the doctor said. He was just keep your mobility as best you can, stay hydrated, eat well, things like that, so that these actually don't freeze up and don't cause more stress on this level. The question will be kind of what happens down here, but at least for me, above my fusion, I'm going to have movement there permanently as long as things stay where they're supposed to. So anyway, this is my neck, not your neck, but my neck. Your trachea, esophagus. It looks weird, that sticks out. I can't feel it, but it's there. I can sometimes I think I can feel it, but it comes and goes. Like I was saying, that kind of that lump feeling, who knows? But anyway, there it is. This is me. This is from the side. I also get AP views. This was the old one. This is the new one. So that's me. That's my neck. I like that the doctor gives me these printouts. They used to just show me the computer screen and I would take a screenshot, but this lets me kind of look at it bigger. Yeah, so there's me. There's my insides and my 2 disc replacements at the top, and then the fusion and the plate in the front. I showed these to my mom and she was like, "You have screws in your neck?" I was like, "Yeah, well, how do you not understand that?" That's so anyway, it takes a lot to kind of want to understand what's happening inside of you. I know some people don't. They're just solve my problems, but for me, I wanted to know all about it. I wanted to know what's my anatomy, how does this mechanically supposed to work? How do I, what am I supposed to do to get the best possible results? So hopefully you all can learn something from me if you are having to go through this, or someone is having to go through this. Yeah, this is a long 20-minute video, so I'm gonna probably end it here, and hopefully yeah, if you guys have questions or comments, let me know in the comments. Subscribe, I don't know, maybe I'll turn this into a real channel, but but for now, I'll probably just sign off and wish you guys all the best. If you guys are going through this and having surgery, just kind of stay positive. For me, I had to just put it out of my mind. I just had to kind of let go and let it be and let other people take control, because you have no control over this. In general, surgery, you should be asleep. So anyway, that's the update. I will come back when I can. Hope you all are doing well. Ask me questions if you've got any others. If you have specific questions, maybe I can come back and do another video about all of that. But anyway, that's all for now. See ya.